Ito po sa baba. Kasi start video para makikita kayo.
Alam mo ba kung ano ang TransFat?
Ang TransFat ay isang uri ng taba na nakukuha sa natural sources tulad ng baka o kambing. O nabubuo sa pamamagitan ng paghahalo ng
Kasi
hydrogen
start
sa
video para
vegetable
makikita kayo.
oil para maging semi-solid sa room temperature. Ang TransFat
Alam mo ba
ay
kung
nabubuo
ano
rin
ang
mula sa
TransFat?
pagpapainit ng mantika sa mataas na temperatura at sa paulit-ulit na paggamit ng mantikang ito.
Ginagamit ang TransFat upang hindi ka agad mapanis ang pagkain. Kaya isinasama ito sa
ng paghahalo ng
Kasi
hydrogen
start
sa
video para
vegetable
makikita kayo.
sa marami nating
oil
pagkain
para maging
araw-araw,
semi-solid sa
tulad ng
room temperature.
margarine at shortening
Ang
na
TransFat
ginagamit
ay
sa
nabubuo
paggawa
rin
ng
mula sa
tinapay at
pagpapainit
iba
ng
pang
mantika
baked
sa
goods,
mataas
mga
na
pritong
temperatura
pagkain,
at sa
tulad ng fried chicken, donut at street
mantikang
food.
ito.
Ginagamit ang
ibang
TransFat
produkto
upang hindi
tulad
ka agad
ng
mapanis ang
coffee,
pagkain.
milk tea,
Kaya
pancake
isinasama
mix,
ito
at
sa mga
ng hydrogen
Kasi start
sa
video para
vegetable. Ang
makikita kayo.
TransFat na nagpapahaba ng shelf life ay
Sa marami nating pagkain
para maging
araw-araw,
semi-solid sa
tulad ng
pinapataas
margarine
ng
at
TransFat
shortening
ang
na ginagamit sa paggawa ng
pinapababa
tinapay at iba pang baked goods, mga pritong pagkain,
at sa
tulad ng fried chicken, donut at street
na maaaring maging
Ginagamit ang TransFat upang hindi ka agad mapanis ang pagkain. Kaya isinasama ito sa mga
Kasi
hydrogen.
start
Maraming
video
masamang
para
ang
makikita kayo.
TransFat na nagpapahaba ng shelf life ay
Sa marami nating pagkain
para maging
araw-araw,
semi-solid sa
tulad ng margarine at shortening na ginagamit sa paggawa ng tinapay at iba pang baked goods. Mayroon tayong magagawa upang maiwasan ito. Gawin natin TransFat para sa karagdagang impormasyon, bisitahin ang ating website o hanapin ang
Kasi start video para
ang
makikita kayo.
TransFat na nagpapahaba ng shelf life ay
sa marami nating pagkain araw-araw,
semi-solid sa
tulad ng margarine at shortening na ginagamit sa paggawa ng tinapay at iba pang baked goods. Mayroon tayong magagawa upang maiwasan ito. Gawin natin TransFat para sa karagdagang impormasyon, bisitahin ang ating website o hanapin ang
Kasi start video para
ang
makikita kayo.
TransFat na nagpapahaba ng shelf life ay
Alam mo ba na ang TransFat
semi-solid sa
ay nagnanais sa paggagamit sa paggawa ng
Ulo, ang dami sasalita.
mayroon tayong magagawa upang maiwasan ito. Gawin natin TransFat para sa karagdagang impormasyon, bisitahin ang ating website o hanapin ang
Kasi start video para
ang
makikita kayo.
TransFat na nagpapahaba ng shelf life ay
Alam mo ba na ang TransFat
semi-solid sa
ay nagnanais sa paggagamit sa paggawa ng
Ulo, ang dami sasalita.
mayroon tayong magagawa upang maiwasan ito. Gawin natin TransFat para sa karagdagang impormasyon,
laban sa heart disease,
o hanapin ang
Kasi start video para
ang
makikita kayo.
TransFat na nagpapahaba ng shelf life ay
alam mo ba ang TransFat sa Philippines ay nagnanais sa paggagamit ng
Ulo, ang dami sasalita.
Good afternoon, everyone. Please settle down and we will begin in 5 minutes. Thank you.
Alam mo ba na ang TransFat Free Philippines Bill ay nagnanais na protektahan ang mga Pilipino laban sa heart disease na sanhi ng trans fat? Ang TransFat Free Philippines Bill ay nagnanais na pangalagaan ang kalusugan ng mga Pilipino mula sa nakakasamang epekto ng trans fat sa katawan. Ipinagbabawal sa panukalang batas na ito ang paggawa, pag-aangkat, pamamahagi at pagbebenta ng pagkaing may partially hydrogenated oils. Ipinagbabawal din ng bill ang pagpaparehistro sa FDA ng mga pagkaing may trans fat na hihigit sa dami ng rekomendasyon ng World Health Organization. Huwag mag-alala, magkakaroon ng sapat na palugit para makapag-reformulate ang mga negosyo at pagawaan ng pagkain. Sa panahong ito, magkakaroon din ng training at incentives upang tulungan ang mga micro, small, and medium enterprises na magpalit at gumamit ng mga mas masustansyang alternatibo. Ano pa bang hinihintay natin? Tara, magtulong-tulong tayo para gawing trans fat free ang Pilipinas. Para sa iba pang impormasyon, bisitahin ang aming website o hanapin ang TransFat Free Philippines sa Facebook, Instagram, at Twitter. Alam mo ba na maaari mong protektahan ang iyong kapwa Pilipino laban sa sakit sa puso? Tumulong ka na maging trans fat free ang Pilipinas.
Ako?
Oo, ikaw nga. Mag-email sa iyong kongresista o senador. Sabihin sa kanila na bumoto para ipasa ang Trans Fat Free Philippines Bill para sa kalusugan ng lahat ng mga Pilipino.
Maaari rin ba akong sumulat sa mga paborito kong restaurant, bakery o food manufacturer?
Oo naman. Sabihin sa kanila na gusto mong gawing mas healthy at trans fat free ang paborito mong cake, donuts, instant coffee at milk tea.
Ang galing! Paano ko maipapaalam sa aking pamilya, mga kaibigan at iba pang tao ang tungkol sa trans fat at masamang dulot nito?
Ipagpatuloy ang usapan online. Mag-post ng mag-post tungkol sa trans fat para malaman ng inyong pamilya at mga kaibigan kung bakit masama ito. Hikayatin mo rin silang suportahan ang pagpasa ng Trans Fat Free Philippines Bill
Para sa malulusog na Pilipino, gawing trans fat free ang Pilipinas.
I-like, i-tweet at i-tag ang Trans Fat Free Philippines sa social media. I-tag mo na rin ang iyong senador at kongresista upang makita rin nila ito.
Para sa karagdagang impormasyon, bisitahin ang website ng TransFat Free Philippines.
Good afternoon, everyone. Hello. Isang maulan at masayang hapon po sa inyong lahat. We're happy to see everyone here. I'm Maan Rosales Santo Domingo from Imagine Law, and I will be your MC for today's Health Literacy webinar on the health harms of trans fat. This webinar is spearheaded by the Department of Health, together with the World Health Organization Country Office in the Philippines and Imagine Law. And before we officially begin, I'd like to invite everyone to bow down their heads and put ourselves in the presence of the Lord for our opening prayer. Thank you.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
Again, good afternoon to everyone. We're very, very happy to see you here. We have a very full house this afternoon. Meron po tayong about 80 participants in Zoom room today, and many others are watching with us in Facebook Live through the Healthy Filipinas Facebook page and the Imagine Law Facebook page. And so before we begin, I know we're all excited to learn about TransFat this afternoon. On your screen now, you'll see a few house rules. So first, we'd like to invite you to rename yourself to indicate your agency and your organization and your name. Again, we'd also like to invite everyone to mute themselves unless you are engaged. Reserve also, please, your questions for the question and answer portion at the end of this webinar. Just in case you have questions that you have recently thought of, you can freely put them in the chat box here and address them to specific speakers. Please also turn off your video during the discussion so we can minimize disruptions and distractions. We would like to invite you to stay present and make the most out of this very exciting webinar we have for this afternoon. Later, we'll also invite you to answer our feedback form at the link that will be provided in the chat box and to be able to get your certificate of participation for this event. And for those who are unable to enter the Zoom room, you can also watch this live through the Healthy Filipinas and Imagine Law Facebook pages. Please bear in mind that all of the presentations this afternoon will later be uploaded in the link as shown. So let's get started. Before we begin, I would like to, it's my pleasure to introduce, of course, the Secretary of Health, who has given us his recorded message, Secretary Francisco T. Duque III, to open today's webinar. Thank you.
A pleasant and healthful day to all. Coronary heart disease remains to be the leading cause of death in the country, claiming close to 100,000 Filipinos annually. This frankly alarming situation necessitates prompt initiatives such as the elimination of trans fatty acids. In 2018, the World Health Organization called on governments of the world to regulate trans fatty acids towards being trans fatty acid free by 2023. The Department of Health, through the issuance of DOH Administrative Order number 2021-0039, calls for direct action to eliminate trans fatty acids. We commit to join the global movement to quash coronary heart disease-related deaths linked to the consumption of toxic trans fat. Further, it is noted that about 1 in every 2 people who perished from COVID-19 had comorbidities, with most of these comorbidities related to coronary heart disease. Therefore, in our efforts to counter the glaring danger of the pandemic, efforts to promote and improve heart health are vital. The DOH, through its Centers for Health Development and other partner agencies, encourages everyone to support the total elimination of trans fatty acids from the tables of each Filipino family. We also call on media practitioners and experts and our partners from civil societies and relevant national government agencies to join the DOH in promoting the elimination of trans fatty acids in the diets of the Filipino people. Of course, the call also goes out to our private sector partners, particularly those in the food and beverage industries, to join us in realizing a trans fat-free Philippines through deliberate elimination of trans fatty acids in food manufacturing and production. To all of the attendees of this health webinar, let us continue our shared responsibility and commitment to realize this pivotal vision and achieve a trans fatty acid-free Philippines by 2023. Maraming salamat po at mabuhay ang pusong Pilipino.
Thank you very much for that meaningful message, Secretary Duque. Again, alam ko maraming mga tanong sa ating isipan. No? Ano ba itong TransFat na ito? Saan ba ito mahahanap? Paano ba natin ito maiiwasan? At tulad po ng sabi ni Secretary Duque, it really is a shared responsibility of everyone. And we're very happy that a lot of you took interest this afternoon to be with us and learn more about this campaign. And as much as policies are necessary to be able to mobilize key actors to move towards significant initiatives such as this one, it's also very important to raise public awareness and, of course, engage the public and educate them all the time. And the Department of Health is leading the way through the Todo Pito campaign. And to talk more about the Todo Pito campaign and the priority area on healthy diet and exercise, I'd like to call on Dr. Dominic Madumba, who is also the Division Chief of the Campaign Strategy and Management Division of the Health Promotion Bureau of the Department of Health. Dr. Madumba, the floor is yours.
Hello po, good afternoon. Magandang hapon po sa ating lahat no, na nanonood ngayon sa ating health webinar on TransFat elimination dito sa Pilipinas. And gusto ko pong pasalamatan lahat ng ating partners and all of those who have been doing this and preparing this webinar to impart knowledge no, saka information sa ating mga kababayan tungkol sa masamang epekto ng trans fat and also on our ways on how to eliminate this food product no, sa ating mga kinakain araw-araw. So thank you. So I'll be explaining po no, and I'll be introducing our campaign on moving more and eating right. Next slide. Next slide, thank you. All right. So dito po sa ating Department of Health, kasama niyo po kami no, on visioning actually a very healthy Pilipinas. So titignan po natin at saka pinapangarap po natin that we will have a healthy Pilipinas where healthy culture, healthy governance, healthy settings, at saka healthy individuals are possible and also present. Next slide. So the Healthy Pilipinas 7 Priority Areas campaign will focus po no, on the health promotion framework strategy's 7 priority areas. So these are actually the pillars upon which health promotion efforts for improving health outcomes will be centered. So with our discussion with our partners, with experts, also with our mga civil organization and other na mga stakeholders no, on health, we have actually pinpointed and identified 7 priority areas that can interface with each other that will eventually have a health impact no, on having a healthy Pilipinas. Next slide. So we have our 7 priority areas. No? Next slide po. Ayan, so we want to promote a lifestyle redesign. No? So titignan po natin kung ano yung pwede natin baguhin sa ating ginagawa ngayon. And we need to assess ourselves no, if these are health dealing activities, health dealing interventions, o kailangan natin magkaroon ng lifestyle redesign. So this is actually spanning 7 priority areas that we want to generate demand no, sa different settings ng ating pang-araw-araw. So this includes our healthy schools, our healthy learning institutions. We also have our healthy communities. And of course, we have also our healthy workplace, which is in the pipeline for the 2022 campaign. Next slide. So what are these 7 priority areas? So we actually have diet and exercise, which will enable improved nutrition and increased physical activity. We're also focusing on environmental health, on minimizing the environmental and climate impacts on health. Our 3rd priority area is vaccines and immunization, which will reduce deaths and disabilities from our vaccine-preventable diseases. Our 4th priority area would be substance use in preventing tobacco and illicit drug use, and of course, moderation of alcohol drinking and the cessation or avoidance of binge drinking. We also have our 5th priority area, on sexual and reproductive health, which promotes positive sexual and reproductive behavior. Our priority area 6 is mental health, which will increase the psychosocial and mental well-being, no, for ourselves and for others also. And our last priority area is violence and injury, which fosters safe and inclusive communities. Next slide. Slide. So A1, no, on diet and exercise. We all know, no, and we that through a healthy diet and an ample amount of physical activity, we prevent po natin yung mga ating or non-communicable, as what Secretary Francisco said a while ago. One of the more alarming, no, diseases that we are actually looking right now, is actually dun sa ating mga coronary heart disease, no. So these are actually mga diseases na talaga pwedeng ma-prevent with proper diet and of course physical activity. We envision a Philippines where under 5 malnutrition is also eliminated and premature mortality, no, dito sa ating mga NCTs are reduced by 1/3 by 2030. So ano po ba yung behavioral outcomes, no? Ano po yung gusto nating makita sa ating mga kababayan with this particular campaign? First, actually, is the adoption of a healthy and balanced diet, basing it on the Pinggang Pinoy and the proportions ng ating Go, Grow, and Glow foods. We also have the incorporation of our regular physical activities and exercise in our activities of daily living. And third, and most importantly, dito sa ating discussion ngayon, is the habitualization of food label reading. Why do we need to do this? Because conscious preference of nutrient-fortified food products is actually our main goal. And the avoidance of non-nutritious food components, such as our salt, our sugar, and of course, our trans fat, no, which we'll be focusing right now. And so for the Todo Pito, we also have not only above the line communication, no, but we also have our social mobilization. So the Health Promotion Bureau has already released, no, ating mga playbooks that actually focuses on healthy diet and active transport. So with we are looking for cooperation, no, and also the future na kasama talaga yung ating mga local chief executives and our mga local government units in actually implementing the playbooks on the healthy diet and active transport, and of course focusing also on sinabi natin on the reading of the food labels that will change the behavior, no, of the consumers, and actually looking at the food products na walang trans fat, hindi masyado mataas ang sugar, hindi masyado mataas ang salt, and actually meron tayong mga healthy and fortified na mga ingredients. So I think that's the last slide on my introduction, no, doon sa ating Todo Pito. So itong lahat po to para sa Healthy Pilipinas. Maraming salamat po.
Thank you very much for that very informative discussion, Dr. Dom. Talagang gustong-gusto ko yung sinabi mo na it's, lahat ito tahi-tahi, and we have to have a healthy culture, a healthy governance. Lahat ito, magkakasama tayo magtatrabaho, hindi lang healthy eating. So ngayon, we'll move on now to our next speaker. Katulad ng binanggit ni Secretary Duque kanina sa kanyang opening message, back in 2018, the World Health Organization called for a trans-fat-free world by 2023. And we're very, very fortunate to have with us this afternoon the World Health Organization Technical Coordinator, Mr. Tyrone Aquino, to talk about the health harms of trans fat and the World Health Organization Replace Action Package. So over to you now, Tyrone.
Thank you, Attorney Maan. Let me share my slide. So can you see my slide?
Yes.
Yeah. So what can you see?
Mukhang masarap yan, Tyrone.
Yeah. So what can you see?
You can see a cake.
Yes. So you can see a cake at the center, right? So usually, ang cake, hindi lang yan pang birthday. Ginagamit din siya or hinahanda siya when you celebrate milestones in life. So imagine the cake in front of you. You can actually look, it looks good, it smells good, it tastes good. And beyond what our senses can recognize, there are actually ingredients of the cake that can harm us. So aside from sugar, there can also be trans fat in it. So for my session today, I'll be discussing the health harms of trans fat, and as well as what the World Health Organization is doing to address this health issue. So to start the discussion, actually, trans fat is a type of fat. So there are actually three types of fat. So nilabelan natin dito, there are actually tatlong garapon, tatlong jars here. Si UFA, SFA, at DFA. So let's see how it differs, trans fat differs from other fats. So we start with the green garapon or the green jar. So this is unsaturated fatty acids or unsaturated fats. So ang unsaturated fat is actually are found predominantly in foods from plants such as vegetable oils, nuts, and seeds. And the metabolic effect is actually an increase in high-density lipoprotein or HDL, or in layman's term, it's good cholesterol. And it decreases low-density lipoprotein or LDL or bad cholesterol. So in general, definitely, it is beneficial to the body. And it is the healthy type of fat, which we want to consume. And then we jump to the orange garapon, the orange jar, which is labeled as SFA, or saturated fatty acids, or saturated fats. So this is mainly found in animal foods and few plant foods such as coconut, coconut oil, and palm oil. And then, anong effect pa niya? So there is increased total cholesterol and LDL or bad cholesterol if this is consumed in large amounts. So generally, it's unhealthy and cause harm if as mentioned, if it's consumed in large amounts. That is why the WHO recommends that the intake of saturated fatty acids should not be more than 10% of the total energy intake. And then, yung pulang garapon, this is actually trans fatty acids or TFA. So this can be found actually in natural sources like meat and dairy products from ruminant animals. So when we say ruminant animals, these are sheep, cows, and goats, and partially hydrogenated oils. So ang partially hydrogenated oils are artificial trans fat, and we'll be discussing that much later. So later. And then ang effect niya is actually the opposite of unsaturated fats. It increases LDL or low density lipoprotein, or sabi nga natin, it's bad cholesterol. And it decreases HDL or the good cholesterol. So this is actually the worst kind of fat. And it is the unhealthiest among the three. And according sa WHO guidelines, this should be less than 1% of the total energy intake. So ito po siya, the three kinds of fats. So we'll be focusing on trans fat. So why create artificial trans fat? Bakit ba nagkaroon ng artificial trans fat? Industrially produced trans fat were actually introduced in the food supply in the late 19th and early 20th centuries with the invention of partially hydrogenated oils or PHOs. I'll use the acronym PHO in my slides, where hydrogen, medyo chemical level, so hydrogen is added to the vegetable oil to convert in the liquid form into a semi-solid form. So they were developed as actually a replacement or substitute for animal fats such as butter and lard. So actually during the 1950s and 1970s, it became popular because during that time, naglabasan yung studies regarding the ill effects or harmful effects of saturated fats. So they wanted to come up with a replacement. So it was originally considered healthier than animal fats. So some other reasons are actually commercial reasons. So because one, its cost is lower than animal fats, so it's cheap. And due to its alteration in composition, it is solid at room temperature. which makes it alter the texture of food products. And it is more stable during deep frying. And it increases or extends the shelf life of foods and oils. So by the late 20th century, an extensive body of knowledge or evidence have accumulated from various sources or studies on the negative metabolic effects of TFA, as well as the relationship of TFA to coronary heart disease. So, ginawa ang trans fat. So, saan ba siya in the food supply? So, first, as mentioned earlier, it's naturally occurring in meat and dairy products from ruminant animals such as cows, sheep, and goats. And then the bulk of it are actually artificial or industrially produced. So the majority or the main source of artificial or industrially produced trans fat are coming from partially hydrogenated oils or PHO. So ano ba yung usually saan nakikita ba ang PHO? So it's a common ingredient in many foods, including margarine, vegetable shorteners, fried foods and donuts, baked goods such as crackers, biscuits, and pies, and pre-mixed products such as pancake and hot cake mix. So yun yung mga actually mga favorites natin kainin, mga comfort food, or pag when we parang it's a incentive for us when we do something good. So parang ganun yung kung saan nakikita ang trans fat in the food supply. So what are the health harms of trans fat? So number one, actually, there are no known health benefits of trans fatty acids or TFA. And then the intake of trans fat is actually strongly related or associated with increased risk of coronary heart disease events, as well as mortality. So the next slides are actually statistics on the effect of trans fat. So globally, more than 500,000 deaths in 2010 were actually attributed to increased intake of trans fat. And in the Philippines, this is based on the 2020 Global Report on TFA released last year, September 2020. So it was actually 2.63% are actually CHD deaths attributed to trans fat. So we translated it to a much simpler statement. So if an increased TFA consumption is responsible for about 3,000 CHD deaths every year. So for the WHO, definitely cognizant of these health effects in 2018, the WHO recognized trans fat as actually an urgent issue to be addressed and identified trans fat elimination as one of the priority targets in the coming years. So on the same year, in 2018, it launched the Replace Trans Fat Action Package to help member states or the countries to eliminate industrially produced trans fat in their food supply. So what is Replace? Replace is actually, it's actually, the word replace actually represents the 6 strategic steps in the technical package. So Re is review, P is promote, L is legislate, A is assess, C is create, and E is enforce. So let's start with review. So when we say review, we review what? The dietary sources of industrially produced TFA, as well as the landscape or situation for required policy change. So let's check ano ba yung kailangan nating review. Una, again, as mentioned in this in the title, sources of industrially produced trans fat in the diet. And next is, as part of the landscape or situation analysis, we also want to check the existing policy environment. Who are the government bodies involved when it comes to policy making? Is there an existing policy already? What needs to be done? And then we also identify key stakeholders for this initiative. And the last one, definitely, we want to also check the costs and availability of oils and fats that can possibly serve as healthier alternative to industrially produced trans fat or the partially hydrogenated oil. So that's review. So next is P, promote. So we promote the replacement of industrially produced TFA with healthier oils and fats. So for this one, actually, the main recommendation of WHO, so this one, so partially hydrogenated oils in products should be replaced with formulations that contain as little SFA, sabi nga natin kanina, SFA, saturated fatty acids, and as much unsaturated fatty acids or UFA as possible. So SFA should only be used in a limited number of applications where there's no alternative. And these are actually some country measures that can be done to operationalize this WHO recommendation. So one, you provide recommendations for replacement. So through research or evidences. Next is engage the food and agricultural industry. And then we need to implement nutritional labeling, or in our case, we strengthen the nutritional labeling. We purchase and use only products containing healthy oils and fats in public institutions and in government programs. And lastly, we increase consumer awareness on how to choose products containing healthier oils and fats. So that's promote. Next is legislate. We legislate or enact regulatory actions to eliminate industrially produced trans fat. So dito, actually, we have two options. There are two best practice policies recommended by the WHO. So one, if you can see here, one direction is using mandatory limits. Will limit industrially produced TFA to a percentage of total fats, such as in the case of Denmark, less than 2 grams of 100 grams of total oils and fats in all foods. And then another option is banning on PHO, or partially hydrogenated oils. So you classify PHO as unsafe or include it in the list of contaminants and other adulterating substances in the food. So this is actually the policies or legislations passed by Canada, US, and Thailand. So later we'll know about the policy with Sir Rodri. So that's legislate. So next, assess, the letter A. So this is actually assess and monitor the trans fat levels in the food supply and changes in TFA consumption in the population. So again, what we need here is to monitor. Once the policy is there, we need to monitor the changes in the levels in the food, the content, TFA content in food. So one is assessment of TFA content of food, and the second one is a population assessment of TFA intake of population or a subgroup of population. So that is assess of the replace. So next is create. Sorry, I'm not sure if I've been muted. So next is create awareness of the negative health impact of TFA among these groups: policymakers, producers, suppliers, and the public. So one, as mentioned here, there are actually groups. Increasing awareness and knowledge of the policymakers. So definitely the policymakers are the ones who will initiate or who will do the work in passing the legislation that we want to address this concern. The second is we want to actually engage food oil manufacturers as well as restaurant owners or operators for them to be educated on the ill effects of trans fat, as well as what they can do to actually address this policy. And then the third one, definitely we want to engage the public through education campaigns for them to know what is trans fat, what they can do to support the cause. And then that's create. And then the last is actually enforce. So what we want to enforce is definitely, once the policy is already there, compliance with policies and regulations. So we want the policy to have clearly defined and enforce penalties for products that do not comply with regulations. And we also want the government or the regulatory body to develop and implement compliance monitoring system. So that is replace. So parang short course on replace. So you can actually access replace. I'll be sharing the link later in our chat box. So this is the link to access the replace action package. So before to end my session, actually, I would like to share some message from the heads of WHO. So one is from Dr. Tedros Ghebreyesus. He actually mentioned this during the launch of the 2020 Global report on trans fat last year, September 2020. So he mentioned that in a time when the whole world is fighting the COVID-19 pandemic, we must make every effort to protect people's health. That must include taking all steps possible to prevent non-communicable diseases that can make them more susceptible to the coronavirus and cause premature death. Our goal of eliminating trans fat by 2023 must not be delayed. And then another message, this is actually a message after the signing of the trans fat or release of the trans fat AO from Dr. Rabindra Abiyasinghe, our WHO representative to the Philippines. He mentioned that the Philippines is rising to the challenge of promoting cardiovascular health amidst this global pandemic through the issuance of this national policy and joining many other countries that have banned the use of industrially produced trans fatty acids in pre-packed and processed foods. The WHO is committed to assist the DOH in implementing this very significant policy that will save many Filipino lives and contribute to the improvement of the quality of life for others. So that's Dr. Rabindra Abiyasinghe. So that's the end of my presentation. Over to you, Attorney Maan.
Thank you very, very much, Tyrone. Ako, siksik liglig. Ang dami kong natutunan. At ngayon, no, ang gustong-gusto kong pinakita mo, Tyrone, talagang mapapaisip ka ngayon kung ang cake ba na kinakain mo ay meron bang trans fat. So dahil in-eliminate na or i-eliminate na ng Department of Health ang trans fat in prepackaged and processed food, dapat in 2 years' time, yung mga kinakain natin as consumers, wala nang ganitong mga toxic trans fat. So maraming salamat for that information, Tyrone. And I also see, no, and I'd like to acknowledge that some of our participants are already active on our chat box. We encourage all of your comments and all of your feedback. Please feel free to converse with us using the chat box. Mamaya po, mas iitingin pa natin ang ating diskusyon tungkol dyan. So maraming salamat. And now, katulad ng sabi ni Tyrone, the World Health Organization called on all countries to replace trans fat and calling all countries to be trans fat free by 2023. And now, our own Department of Health in the Philippines answered the call to make healthier food for Filipinos, healthier hearts for Filipinos. And I'm very privileged to call on our next speaker, Mr. Rodley Carza, the Division Chief of the Policy and Technology Division of the Health Promotion Bureau of the Department of Health, to talk about this latest administrative order of the Department of Health on trans fat elimination. So turning over now the virtual mic to Mr. Rodley Carza. Thank you.
Thank you, Attorney Maan, at good afternoon po sa ating lahat ng participants sa webinar nito at sa mga nanonood po sa YouTube at sa Healthy Pilipinas Facebook page. I will present po, as mentioned by Attorney Maan, the recently issued DOH Administrative Order entitled National Policy on the Elimination of Industrially Produced Trans Fat for the Prevention and Control of Non-Communicable Diseases. But before discussing this policy, we must first understand what trans fat is and what it does to our body. Although our colleague from WHO has already provided a very comprehensive overview of this topic. No? Can I have the slides, please? Thank you. So as mentioned po by Tyrone kanina, trans fat can be both naturally occurring and industrially produced. And for trans fat na coming from naturally occurring, these are found in digestive systems of ruminant animals such as cattle and sheep, as mentioned a while ago. But it can also be produced industrially. This policy po that we recently issued focuses on industrially produced trans fat. And it is primarily sourced from partial hydrogenation of fats and oils. Ginagawa po ito because of the following effects no, sa pagkain. Una, it alters the texture and form of the fat or oils. And then it increases the stability of oils for frying and grilling. And it increases the shelf life of the food products. Industrially produced TFA po can be usually found in products such as prepackaged goods. In the next slide, the baked goods as well as spreads, butter, and shortening. Makikita din po natin o malalaman din po natin na merong trans fat ang asang pagkain kung titignan po natin ang ingredient list ng ating kinakain. So, makikita po natin pag nakalagay na kahit na nakalagay na 0 grams yung trans fat niya, pero makikita mo sa ingredients na merong partially hydrogenated oil, potential po or meron po siyang trans fat. So maging mapanuri po, always check the label when buying food that is important that we consume. It is important to always check the label. Now, papahapyawan ko lang po yung kunting nabahagi na po ni Tyrone from the WHO kung bakit masama po ang trans fat sa atin. Essentially, high consumption of trans fat is associated with cardiovascular diseases and other non-communicable diseases because of the effect that they have on cholesterol in our bodies. And we need cholesterol because it has many functions that maintain the regular processes in our bodies. However, meron po tayong tinatawag na good and bad cholesterol. Good cholesterol is also known as the high-density lipoprotein, and bad cholesterol is also known as the low-density lipoprotein. So yung bad cholesterol po natin, it builds up in our blood vessels, while good cholesterol helps naman in dislodging or clearing out the bad cholesterol that accumulates. As you can see po in the slide, the bad cholesterol, nag-build up po siya sa gilid, no? And the good cholesterol, which is the HDL, helps take them away. With the high intake po of trans fat, this increases the bad cholesterol and decreases the good cholesterol in our bodies, therefore leading to CVT, such as coronary heart. So yun po yung kanyang primary na effect sa ating katawan. Now, ano po yung pwede natin gawin dito sa problema or issue na ito? Sa next slide po, makikita po natin that the DOH issued the Administrative Order 2021-0039 or the National Policy on Elimination of Industrially Produced Trans Fatty Acid for the Prevention and Control of Non-Communicable Diseases. And zooming in on the policy, next we have the regulation. Sorry, previous slide, please. Previous slide. Yeah. So zooming in po, we have po regulations on TFA content of pre-packaged food products. In the next slide po, makikita po natin na we regulate food establishment and food manufacturers from producing, importing, and distributing pre-packaged and processed food products containing industrially produced TFA. Can I have the next slide, please? Okay, sorry, a little back. Apologies po for the technical difficulties. Yan. So, ano pong ibig sabihin nito sa atin, no? So, the policy po seeks to provide a policy framework to initiate efforts to gradually eliminate TFA from the nation's food supply, and it's complementary to similar legislative efforts. Next slide. Okay, so currently we have several bills filed in the Congress or House of Representatives and in the Senate that would further aid in the elimination of TFA. Now, for this AO specifically, we are only focusing on industrially produced trans fat. And aside from the health benefits of eliminating TFA, the next slide, this policy also set the ground for the Philippines not to be vulnerable to becoming a dumping site po ng TFA-rich food. Dahil po ibang countries or neighboring countries in Asia and other continents are starting to also set regulations of TFA. The absence of such regulation in our country makes us vulnerable in becoming a dumping site po of these food products that are rich in or high in trans fat acids. In the next slide, ito po yung mga specific aims and objectives, goals and objectives ng ating polisiya, wherein by 2023, we hope to eliminate industrially produced TFA in the country's food supply already. Specifically, we want to maintain and further reduce the TFA intake among Filipinos to be less than 1% of the recommended total energy intake. And magagawa po natin to sa mga sumusunod na strategiya. Una, i-regulate po natin yung prepackaged food products containing TFA, meaning hindi po natin, hindi po maaari na lagpas sa prepackaged food. Then we will enable the replacement of TFA with alternative oils, fats, and oilseeds. And lastly, we will increase awareness of the negative impacts or ill effects of high TFA po sa atin pong lahat. In the next slide po, we can see the salient provisions of the AO. We organize it in such a way to provide the framework for the efforts needed to slowly eliminate TFA from our country's food supply. Next is the regulation in nutrition labeling, and this would include regulating how food manufacturers would label their products such as TFA-free and having them ensure factual disclosure of information in the nutrition labeling of pre-packaged food products consistent with their existing regulation. And lastly, through social activities such as replace products. Next slide, please. So zooming in po on the regulations of TFA content, pre-packaged food products, we will regulate food establishment as well and manufacturers from producing, importing, and distributing prepackaged and processed food products containing industrially produced TFA. What does that mean po? No? Does this mean that the policy will eliminate these products in the market? The answer po doon is no, because there are alternative fats and oils that can replace TFA in the food products and provide the same function. TFA in food shall be replaced through product reformulation or replacement of the oils that we use. Then replacing TFA has little to no effect to the taste or the cost of the food as well. Specifically, the following po will be prohibited for pre-packaged food products. The next slide. Ayan. So makikita po natin na partially hydrogenated oils to be consumed alone or used in the preparation of food products. Then oils and fats made blended with partially hydrogenated oils and fats with trans fatty acid content of more than 2 grams per 100 grams, and processed and prepackaged food with DHO and high TFA content. Okay, so the next component of our framework po is the regulation or the provision on nutrition labeling. So food establishment will not be allowed to claim that their food product is TFA free. Likewise, food establishment shall ensure the factual disclosure of TFA content in their nutrition labeling consistent with existing FDA rules and regulations. So sa susunod po, papakita po natin yung example. Hindi po maaari na mag-claim ang isang produkto na siya po ay trans fat free. No? Piniprevent po natin yung tinatawag nating halo effect here, wherein dahil nakalabel na trans fat free siya, akala natin healthy yung pagkain. Pero in actuality, marami pala siyang sugar or marami pala siyang salt or marami siyang ibang components na doesn't make it necessarily healthy. So kasama kaya po meron po tayong provision sa policy na to na bawal ang trans fat free claims pagdating po sa produkto. At pagdating naman po sa nutrition labeling, dapat po tama yung nakalagay or nakadisclose na nutrition or trans fat levels sa ating nutrition facts na makikita po sa likod ng ating mga pakete. Ayan. And for the last component po of the strategies or framework to eliminate trans fat, which is social preparation. This includes po capacity building of individuals, academe, and research institution to support the elimination of trans fat through various learning and development interventions. And we will also strengthen our information and education campaigns on TFA intake, its food sources, and ill effects para po mas alam po ng tao kung ano po yung kanilang kinoconsume at kung ano man yung kaakibat nitong risk or ill effects kung ito ay sobra-sobra. No? For the social preparation, in the next slide, we can see po na while we await the passage of the several TFA elimination bills in the Congress, we need to start working on 3 things, namely number 1, research for alternative fats and oils, and education of ill effects on TFA and its sources. Plus, tuloy-tuloy po ang ating advokasya for healthy diet and physical activity as presented po by Dr. Meng Madumba earlier. In the next slide po, makikita naman natin iba't ibang ahensya na nagtutulungan para po patuloy nating ma-enforce. No? Ito po yung E ng ating replace na acronym. So, katuwang niyo po ang DOH at FDA at ang NNC sa pagpapatupad at pag-i-enforce ng polisiyang ito. And actually, FDA plays a very crucial role in developing or issuing the regulatory guidelines on this. No? But in the AO po, that the FDA shall issue the regulatory guidelines not more than 2 years from the effectivity of the AO. So that would be in July 2022, kung di po ako nagkakamali, or 2023. Yeah. Next slide, please. Yeah, now that what we can expect po out of the TransFat policy, no? Through the elimination of TFA from the nation's food supply, we hope to decrease the risk of developing cardiovascular diseases and other non-communicable diseases po in the country. And since the UHC reform, we have been shifting our efforts toward health promotion and preventive care. Di na po natin kailangan hintayin na magkasakit po tayo. No? I-promote na po natin ang ating health and well-being. So kasama po nito ang pag-foster ng isang healthy food environment, ensuring na yung availability po ng ating pagkain sa environment ay healthy talaga. No? And being able to improve our health through healthy diets is one of the steps towards ensuring health promoting and equitable development in the country. And this policy, no matter how gaano po kalaki yung kaakibat po nitong trabaho, is just one small step that we can take forward in order to create the healthy Pilipinas for all. This is just one of the interventions that we will do, and marami pa po tayong in-expect na issuance or polisiya na hopefully will make our food environment a little bit healthier for all of us to achieve a healthy Pilipinas. Maraming salamat po.
Maraming salamat, Sir Roddy, for that presentation. No? Gustong-gusto ko din yung sinabi mo na talagang maraming interventions ang Department of Health, kasama ang mga partner organizations nito, partner government agencies, civil society, at even ang mga stakeholders na nandito sa room ngayon. Lahat tayo kailangan may shared responsibility talaga sa pag-improve ng ating diet at pagpapabuti pa ng ating food environment. Gusto ko din na dito sa AO ng Department of Health, talagang kitang-kita na integrated yung approach na in-apply. Merong looking into the demand side, into the supply side, and even in the social preparation side. I think marami tayong mga tanong mamaya, pero we'd like to acknowledge again all of the participants who have raised their hands or typed in their questions in the chat box. We will have time for that in the open forum in a bit. And we're very excited to discuss more with you regarding the DOH-AO 2021-0039. So we're asking for your patience lang po. On now to our last speaker. As Sir Roddy mentioned, there are a number of strategies that are in place. Hindi lang po isa, kundi tulong-tulong at tahi-tahi. Integrated ang approach ng Department of Health towards TransFat elimination. And to talk about complementary measures with regard to TransFat elimination, we have our next speaker, Attorney Mikhail Milian, a policy associate of Imagine Law, to talk about the TransFat Free Philippines Bill and the advocacy campaign on TransFat. So over to you now, Mikhail.
Thank you, ma'am. Let me just share my screen first. Okay, so good afternoon again to everyone. My name is Attorney Mikay Lawrence Melian, a Policy Associate of Imagine Law. And for this afternoon, I will be discussing the complementary measures for trans fat elimination. So this would include the Trans Fat Free Philippines Bill, as well as our ongoing communications advocacy campaign. So a while ago, Mr. Rodley Carza wonderfully explained that the DOH Administrative Order 2021-0039 sets the policy direction of our country in the elimination of trans fat. However, the DOHAO is only limited to regulating prepackaged and processed food. So this is where the Trans Fat Free Philippines Bill, or TFFP bills come in. So before I go further on about the bill, let me just give a brief background on how the bill was developed. So the bill was developed pursuant to and in accordance with the WHO Replaced Action Package. Health experts and the industry were consulted in the development of the bill to determine feasibility of the policy. Meaning, bago din-develop yung bill, ay nalamunan natin ang mga gaganang interventions dito sa ating bansa. So interventions in the bill are based on evidence-based best practices. We are not the first country to regulate trans fat, and we definitely won't be the last. So the interventions in the bill are based on the regulations of other countries that have already successfully regulated trans fat. So those are the interventions that are in the bill right now. So we have two bills, kinds of bills. We have bills in the House of Representatives, and we have bills in the Senate as well. For the House of Representatives, we have House Bills numbers 7200, 7202, 7934, 8093, and 8128. These bills were authored by Representative Alfred De Los Santos, Representative Ronnie Ong, House Health Committee Chairperson Representative Angelina Helentan, Representative Louis Raymond L. Ray Villafuerte, and Representative Joy Myra Tampunting, respectively. So the the House bills were approved in principle by the House Committee on Health last December 9, 2020, and we are now currently waiting for the release of the committee report. For the Senate bills, we have Senate bills number 1916 and number 1954. These were authored by Senate Health Committee Vice Chairperson Senator Nancy Binay and Senator Francis Kiko Pangilinan. The bills are currently pending with the Senate Trade Committee. Okay, so how do the bills complement the AO exactly? So as mentioned a while ago, the AO is limited to only regulating trans fat in prepackaged and processed foods. The bill will be covering everything else that the AO cannot cover. So in this case, the bill will be regulating food produced and marketed in traditional markets and food service establishments in our local government units. In the bill, there is also a provision on research and development where we will be identifying and developing healthy alternative oils and food products, such as healthy alternative oil seeds through crop diversification programs and agricultural research in coordination with our Department of Agriculture, as well as healthy food products through product reformulation and research and development. So yung product reformulation po natin, hindi po natin sabihin tatanggalin natin yung produkto or yung food item mismo, but there will just be a change in its recipe. Particularly in this case, the elimination of trans fatty acids. So under the bill, there will also be no importation fees for TFA testing equipment, meaning any TFA testing equipment that we import, it will be duty free. The bill also provides for fines and penalties for food business operators in violation of manufacturing, importing, distributing, and selling of partially hydrogenated oils, oils and fats with high TFA content, and processed and prepackaged food with PHOs and high TFA content. So The bill provides these penalties as a deterrent, no, for any person or company who will be violating the provisions of the bills and the AO. All right. Finally, on the enforcement and implementation of the bill, there will be a promotion of multi-sectoral coordination in the development of related policies under the bill, all the while safeguarding against potential conflict of interest, meaning the public health will be the number one concern and consideration in the development of policies. Okay, so now allow me to answer a couple of questions everyone might already have regarding TransFat regulation, some of which na-answer na already ni Sir Rodley. But allow me to repeat some of those answers for everyone concerned. So first one, will I still be able to eat my favorite food like pizza, fries, or the cake a while ago when we regulate TransFat? The answer is yes, we can, but without now the risk to our hearts. The regulation is not on the food per se, so hindi natin nire-regulate mismo yung pizza, yung fries, yung donuts, yung cake, but the regulation will be on the ingredient that contains trans fat. So the regulation covers partially hydrogenated oils or yung mga PHOs, which is the main source of trans fat in our diet. So PHOs are used to increase the shelf life of food, kaso naman decreasing our own lifespans. So tumatagal nga ang pagkain sa ating mga kusina, pero nababawasan naman ang buhay natin dito. So replacing PHOs and removing trans fat does not affect the taste and cost of food. So which brings me to the next question. So will there be an increase in the price of food when we regulate trans fat? And the answer is no. As I just mentioned, removing trans fat does not affect the taste and cost of food. In fact, it protects the most vulnerable sectors of society since they bear the biggest non-communicable disease burden. It ensures that the products that we all consume does not increase our risk of illness or death, and therefore prevents future expenses on healthcare. So what happens if we don't regulate trans fat in the Philippines? So this was mentioned a while ago as well. We can become a dumping ground for TFA-rich food. So if we don't have regulations, food companies that produce and export food with trans fat will be able to sell their harmful food to us. We know this already because this has happened before with the countries like Argentina and Slovenia. So how do we become a dumping ground ba in the first place? So allow me to explain real quick. So what happened before, for example, with Argentina was all the surrounding countries around Argentina started regulating trans fat. So the companies that used to export food containing trans fat before could not anymore export to those countries around Argentina. So ang nangyari is lahat ng food with trans fat napunta sa Argentina, naging dumping ground sila because they were the ones left not regulating trans fat. And that is what we are trying to avoid here. That is what we're trying to achieve with our trans fat regulation here in the Philippines, especially since our ASEAN neighbors have already started regulating trans fat like Singapore. Finally, what will regulating trans fat cost our healthcare system? It will result in savings, big savings in fact. So we have a couple of examples here how regulating trans fat or the results of regulating trans fat will be for our healthcare system. In the United Kingdom, when they regulated trans fat, they had a 5-year net savings on their health costs. In New York, when they regulated trans fat, they had a 7 to 8% decrease in hospital admissions for heart attacks between 2007 and 2013 as compared to states without trans fat regulation. And finally, in Argentina, they had 300 to 1 to 1,517 cardiac deaths avoided every year since they regulated trans fat. They had an estimated projected savings of $17 million to $87 million in annual healthcare costs. So what does that mean for us? No? What does that mean for the Philippines? So when we regulate trans fat, the possible healthcare costs that our country will be saving can be allotted for other basic services. So the most immediate example I can think of would be for COVID-19 services. And that is one effect that can happen when we regulate trans fat. All right, finally, for our frequently asked questions, can we even eliminate trans fat in the Philippines? Are we ready to do that? The answer is yes, we can again, and yes, we are. So PHOs, the main source of trans fat, is a very small percentage of the total oil market here in our country. Only 2.5% of total oil production belongs to PHOs, and only 4.5% the total oil market. In fact, there is only one PHO manufacturer here in the Philippines. So globally, and in fact locally as well, PHO is on the way out. So we should shift now so that our food manufacturers can export to countries with trans fat regulations already, such as the United States and Europe. All right. So how can you help create a trans fat-free Philippines by 2023? So the Trans Fat Free Philippines campaign is a multi-sectoral advocacy campaign. The goal is to improve the overall health and lifestyle of all Filipinos by eliminating industrially produced trans fat from the Philippines food supply. It implements the WHO Replace Action Package by building both public and policymaker support. So how far are we from our goal? We are almost there. Meron na tayong DOHAO, and the Trans Fat Free Philippines bill is currently pending in the Senate and Congress. So the bill, as discussed a while ago, will cover all types of food items, including those outside the scope of DOH and the FDA. So why should you participate in this advocacy? Because you are the main stakeholders of this health measure. As Filipinos, we have the right and duty to participate in healthcare promotion. You are part of the collective action towards better health policy making. So if and when the bill becomes law, it is not just a victory for our hospitals, it is not just an achievement for our lawmakers, but it is a victory and achievement by and for you. Para sa lahat ng Pilipino ang magiging tagumpay na ito. Luzon, Visayas at Mindanao. So this will be a victory para sa puso natin lahat. So how can you take part in this health movement? So we invite you to actively take part in this advocacy by first, send an email to your legislators and let them know that you care about this issue. So how do you do that? You can visit transfatfreephilippines.org and click on the Take Action button. From there, click Send an email to the Senate or visit transfatfreephilippines.org/takeaction. So civil society participation, especially in this day and age, plays a big role in effecting change. We would like to invite each and every one of you to join the advocacy and be part of the movement that will deliver healthier Filipino hearts for everyone. So I will be providing just 4 steps on how we can join the advocacy. First, visit our website at transfatfreephilippines.org and click on the Take Action button. Or you can also visit the page directly, the one I mentioned a while ago, transfatfreephilippines.org/take action. We can put the link later in the chat box. And then step 2, how to send an email to the Senate. On the Take Action page, click the Send an Email to the Senate button in the middle of the page. Yan. Step 3, you will be directed to the Do Gooder page where you can learn more about the campaign. So click the plus sign and read the full text at action.go.do/transfatfree-Philippines. And finally, how do we send an email to the Senate? When you actually go to the site, there will already be an email template there. So you can feel free to personalize it by putting in your own experiences and own concerns. And all you need to do is put your name and your email, and then that's it. Click send an email, and you have taken part in the movement. So we encourage everyone here to visit our website and take action by sending an email to your legislators. Let's all work together towards a trans fat-free Philippines and a healthy Pilipinas. So let's be trans fat-free by 2023. Please visit the Facebook page, TransFat Free Philippines, our Twitter also, TransFat Free PH, as well as our website, transfatfreephilippines.org. Maraming salamat.
Thank you very much, Mikhail. Maraming salamat for that presentation. Again, no, dito natin nakikita na talaga lahat tayo ay stakeholders in health. Health is really a shared responsibility for all. And we hope that what you learned this afternoon from this webinar will encourage you and empower you to take part in this advocacy, not only in TransFat, but also in the bigger healthy diet, in the bigger health promotion campaign. So dyan po nagtatapos ang ating series of lectures this afternoon. Ngayon po pupunta na tayo sa mas masaya at mas engaging na talakayan. Bago po doon, I would like to remind everyone to fill out and answer our feedback form, which will the link of which will be provided in the chat box. And now I'll be turning over the floor to Ms. Trisha Descaliar from Imagine to facilitate the open forum. Over to you, Trisha.
Hello, everyone. Good afternoon. So my name is Trisha, Communications Officer for Imagine Law. Again, thank you so much for joining us today and sending in your questions. We'd be happy to answer them, so let's get right into it. So we have our first question here from B. Dumelod from UPD, questions and comments as well. So she says, thank you for this discussion. It's true that trans fat must be eliminated from our diet. However, please allow me to point out a couple of things. So she says, the first is unsaturated fats are not always healthy. They are more susceptible to oxidation and production of toxic compounds compared to saturated fats. The second statement is saturated fats are not created equal. Not all kinds of saturated fats result in increased total cholesterol and LDL. For example, coconut oil is rich in saturated fat, but these are mostly medium-chain triglycerides or MCT. These MCT do not behave like long-chain fatty acids, which can lead to CVD. So we'd like to direct these statements or these comments to WHO. So Mr. Tyrone Aquino, if you could care to share the response for this.
Thank you, Trish, and thank you, Ma'am Dumelod, for pointing this out. So actually, the greatest advantage is obtained when partially hydrogenated oils are replaced by oils rich in unsaturated fats. But definitely the choice of fats and oils used in many countries will be influenced by the availability, the cost of the replacement alternatives, as well as the oil industry's capacity to innovate. And definitely the alternatives to PFA, particularly PHOs, will also depend on the functionality on which the PHOs were originally used. So the WHO recommendations were actually based on evidence generated from meta-analysis, and extensive analysis of research was done on these topics over the years, and it's constantly updating as new evidence comes in. So if there are new evidence says that arise, as mentioned, this will definitely be considered in the analysis as basis for updating the recommendations as needed. But as of the moment, the recommendations of WHO, as mentioned, stand based on the latest appreciation of evidence globally. Thank you. Over to you, Trish, or maybe comments from DOH partners. Thank you.
Yes, if there is anyone, Sir Rodley.
Yeah, thank you for this comment, Professor B. I think this also highlights the importance of strengthening our information and education campaign in terms of nutrition in general. No? And siguro just a quick advice on nutrition, we always go back to the principle of balance, moderation, and variety. So if we're thinking of our next food that we will eat, always think of those three. Do I have enough? Is this a balanced diet? Do I have enough variety of foods? And moderately ko ba siya kinakain or sobra-sobra na? So regardless of saturated fat or unsaturated fat, I think yung moderation is very important. And hindi lang talaga natin kailangan lang talaga nating i-eliminate yung trans fat. I think that's very clear po in our discussion this afternoon. But thank you very much po for pointing that out, Professor B.
Thank you so much. Thank you so much for those comments and questions as well. We do have one question here from the Zoom chat. So we have Miss Marigold Rillera who has her hand raised. So hi, Miss Marigold. Please unmute and turn on your video if able. So the floor is yours. You may ask your question. So hi, Miss Marigold. If you would like to ask your question, feel free to send it in the chat box, or please flag if you'd like to ask it yourself for now, for here. But while we're waiting for Miss Marigold to ask her question, we'd like to move on to this next question from Facebook. So Odd5 asks in Filipino, nais ko lang pong itanong, ngayong pandemya, maraming kabataan ang naliligalig mag-order at kumain ng mga hip na food trends at karamihan doon ay nuknukan ng dami ng trans fat. Ang tanong ko, anong edad po ba kailangang magsimula mag-alala ang mga kabataan sa pagkonsumo ng mga pagkaing puno ng trans fat? Ayun po ang ating tanong. WHO, DOH po.
Sige po, siguro I'll take first, I'll try to answer first. Anong edad ba dapat mag-alala tayo for trans fat? I think it's very important that we start parang informing our population or the Filipino people at a very young age because ito yung pinaka-critical, yung kabataan po, no, yung pinaka-critical time where we develop our behaviors that we carry throughout our lifespan. So I think bata pa lang po or sa kabataan po tayo mag-focus. And in an exploratory study po, I think conducted by FNRI, makikita po natin doon na yung kabataan po talaga or yung mga school-age children, yung pinaka-mas at risk of trans fatty acid. So, sila po yung may mataas na intake of trans fat. Marahil siguro dahil na rin sa baon nila, ay baka po sa mga biscuits or cookies or baon na usually binibigay po sa kanila. No? So I think as parents, we must be very aware of the food that we give to our children for their nutrition, and we start the healthy behaviors at a very young age. So invest in promoting healthy behaviors po sa kabataan. But of course, it's never too late for us to develop healthy behavior. So if we're aware na po ngayon na meron palang health risk itong aking ginagawa pag-order ko, baka pwede po nating suriin ulit yung ating kagawian at mas mag-shift po tayo sa mas healthy na behavior. Yan lamang po.
Hi, my hand was raised po kanina, but did you notice ba? I just have to confirm if you noticed or what.
Hi, Sally. Yes, we do have your questions noted.
I know. Okay, sorry. Question, what fats are good for poodles to eat?
Hello, Ma'am
Hi,
Sally.
Sally.
Hi, I'm sorry if it's not working, but what fats po are good for poodles to eat?
Yeah.
Yung mga poodles, what fats are okay for them to eat?
Yeah. Thank you for that question, Sally. I'll take over from here. We'll look into that because right now I think our experts here are on human nutrition. But we'll take a look at that and come back to you later. Thank you for that question. For all questions, please type in the chat box. Sige, we'll address
What are
it.
the benefits po of studying nutrition? Ano po yung mga benefits, Sir Rodley and other experts, of studying nutrition?
Thank you, Sally. Sige, Rodley, go ahead, please.
Okay, sige. So, thank you for Sally for that question. It's a very good question. I'll geek out a little bit. If you look at the global burden of disease in the Philippines, actually dietary risk plays a very huge role, a very critical role in shaping our global burden. So this is about deaths, Ito din yung mga disability-adjusted life years, what we call in epidemiology. No? And kasama nito yung tobacco, air pollution, but dietary risk really is number one of the top 5 causes of global burden or burden natin sa Pilipinas din pagdating sa health. So studying nutrition, I think is a very important endeavor. No? So we can address all these dietary risks and improve our food environments, no, and health interventions to better promote health and nutrition. So yan lang, Sally. A little geeky yung answer, but it's one of the driver of our health situation in the country. So it's very important that we study nutrition.
Thank you for that. If we don't have any other notes on that point, we do have one more question here from the Zoom chat from Hector Maglalang, who says, for your information, Nutrition Foundation of the Philippines is starting this week a rapid assessment of trans fatty acids in the Philippine food supply. My question is, has there been discussions with the only PHO producer to reduce or eliminate PHO production? And do you have any information on importers of PHO?
Okay, siguro I'll answer na lang that, Trish. Yes, there has been discussions naman on the producer. No, I'm not sure if only producer is the Oleo Fats, but I think we're very fortunate when we're developing the policy as well. Nakasabay natin yung hearings on the trans fat bill. So we were able to hear the positions of the industry and various stakeholders pagdating sa food manufacturing. And yeah, so it has been a consultative process naman from the very beginning, and we thank then our partners from WHO, CSOs, and other private institutions who have joined the public consultation when we drafted the policy. Thanks, Trish.
All right. Did anyone else want to chime in or add anything else to that? All right. So if none, we do have another question here. This one is for the Trans Fat Free Philippines bill. This is also from the Zoom chat. So Kevin asks, paano po yung mga packaged foods na walang label, mako-cover po ba ito ng bill? I think we can direct this question to Attorney Milian.
Yes. Well, first of all, it will be covered by the bill since the bill encompasses both prepackaged and processed foods as well as foods sold and produced in traditional markets. So I guess dun po yung mga foods natin na walang label. So the bill provides for enforcement as well for foods that are sold in the traditional markets through coordination with the LGUs.
Thank you so much. Thank you for that. All right. So we do have one more question here. This one is actually about the DOH program. So this is from Facebook, from Shin Yap, who asks, hi po, I just want to ask po about, aside from eliminating trans fat, is there any solution for our country to have healthy citizens except for those programs and projects that are currently ongoing? So this is on the DOH programs, nutrition.
Thank you, Trish, for that question. There are a lot of programs that we're implementing, no, and also planning to implement. I don't know if you've seen the introductory presentation by Dr. Meng Madumba, wherein he highlighted the importance of, or the priority areas of the Department of Health in terms of health promotion and the strategies of addressing or promoting health, no, across our lifespan. So from school, parang early first 1,000 days until our last year's life course approach po tayo from womb to tomb. At the same time, we prioritize certain topics. So we have 7 priority areas as presented by Dr. Madumba. And we also try to promote healthy settings. In the Universal Healthcare Act, kailangan po meron po tayong healthy schools at healthy communities, and these priority topics po will be integrated in that settings, no, sa schools and communities po natin. So we approach health promotion from a very holistic and comprehensive way. And doon po sa example natin, specific for priority action or priority area number 1, which is nutrition and physical activity, Dr. Madumba has shown 2 playbooks, local health system playbooks, wherein LGUs can actually use these playbooks to implement health promotion programs in their locality. No? So, kumpleto na po, package na po itong playbook na to. Nandun na po yung implementation plan, campaign materials, capacity building plan, etc. Pati po template ordinance nandun na. And it's really up to the local government on how to further improve the health of their constituency. The playbook is there, available for their use. Kailangan sila na po mag-political will na lang, and the DOH po will be here to support the LGUs in the implementation of the playbook. So bukod po sa pag-email natin sa Senado at sa Kongreso na ipasa ang TransFat bill, baka pwede po natin sabihan ang ating mayor at governor, Gov, Mayor, baka naman pwede po tayo mag-implement ng health promotion playbooks sa ating local government. And with this po, we hope that our communities will be healthier and conducive for us to reach our optimal health. And as we work po on healthy communities and healthy schools, we take note of the necessary interventions then that we need to implement in the future. And kung meron po kayong feedback or suggestion, feel free po to reach out with the department. Salamat po.
Thank you so much, Sir Rodley. All right, we do have Ms. Marigold Riliera, who reconnected and still has her hand up. So Ms. Marigold, if you'd like to ask your question, you could please unmute and turn on your video if able, so you can ask your question, or feel free to send it here in the chat box. All right, so we'll wait for any other questions in the chat box. We just have one more question left here. Sally asked a follow-up question on picky eaters, on how do you manage or how do you deal with being picky eaters, and how do you encourage that, or how do you encourage them to have healthier food choices?
Okay, I'll take the first shot po, and then maybe our colleagues from WHO and Imagine can also jump in. But again, I go back po to the concept of the 3 principles for healthy nutrition, which is balance, variety, and moderation. So for picky eaters, baka po we just need to find the right variety for us to ensure din po that our food choices would be parang also balanced, and there's enough variety din na hindi lang isang meal kinakain natin na paulit-ulit. So again, plenty of fruits and vegetables kung maaari. And then importante rin naman yung carbohydrates and other food components as well. But again, I always go back to the principle of balance, variety, and moderation. So yun lang po. Thank you.
Would anyone else like to add on to that? Because if not, we have one last question here from YouTube. Lily S, who asks, how can you say po na high in trans fat ang isang food? Or if my trans fat po ang food, automatically it's already high in trans fat. So this question is on the volume, or what is considered as high for trans fat intake. So I think we can direct this question first to WHO. Can answer that on trans fat consumption.
Yes, actually, based on the WHO recommendations, the trans fat, when we talk about intake, it should be like less than 1% of the total energy intake. And when it comes to, when we translate this, actually just 2.2 grams per day of the total intake. So and also we definitely check trans fat levels using nutrition labeling. We read them, but not just the trans fat row there, but we also check the content or the ingredients used in the food items. So pag may nakalagay doon na partially hydrogenated oils or hydrogenated oil or vegetable shortening, so usually those are items or food products that or contains trans fatty acids. And Sir Rodley or Attorney Mikhail can actually add something.
Yeah, so dagdag ko lang rin sa sinabi ni Tyrone, yung importansya talaga ng checking the label. So, tignan natin kung yung bang trans fat na nandun sa nutrition facts sa ating pong mga pakete, hindi nag-exceed dun sa amount na recommended po ng WHO. And for manufacturers naman, we hope that we can ensure factual disclosure of trans fatty acid content in your prepackaged food. So, essentially, yun lang talaga, no? We just need to ensure that the trans fat will not exceed the recommended levels. And of course, kaakibat nito yung responsibilidad ng factual disclosure of TFA content.
Add lang rin ako sa question, sa answer ni Tyrone and Sir Rodley. So when you read the nutrition labels, importante to check the serving size as well and the number of servings per package. So for example, if the snack contains 3 servings, and then that means eating the entire package agad would mean you're consuming triple the calories, macros, and trans fat as well as listed on the label.
Thank you so much. Oh, fantastic. Thank you for that very holistic answer, a very holistic approach to the question. All right, but so with that, I'd like to just acknowledge the comment here left by Ms. B. Dumelod, and we would agree and believe this was also addressed earlier, and we would just like to agree that, well, that really more research is needed, as mentioned by DOH. And so with that, I believe that's all the questions that we have at the moment. If you do have any other questions, please feel free to connect with us. We are TransFat Free Philippines on Facebook, or you can PM us there, or you can also visit our website, transfatfreephilippines.org. Thank you so much. Back to you, Maan.
Thank you so much, Trisha. Thank you, Tyrone. Thank you, Mikhail, and thank you, Rodney. And that ends our open forum for this afternoon. Thank you, everyone, for your very active participation. Before we end, I'd like to thank again all of our panelists who shared their expertise with us this afternoon. We learned a lot. We learned a lot about trans fat and its harmful health effects and why we should avoid it. Kung saan natin siya mahahanap, paano tayo magiging mas vigilant as consumers, and hopefully how we can all contribute towards that goal of a trans fat-free Philippines by 2023. So before we end our session today, we have a closing message from the Director 4 of the Health Promotion Bureau, Dr. Beverly Lorraine Ho. While we're waiting for the recorded message, there you go.
In 2018, the WHO called on all governments of every nation to regulate TFA with the goal of being TFA-free by 2023. Eliminating TFA in the food supply is a low-cost and efficient way to reduce the number of cases and mortalities from cardiovascular deaths and other NCDs. The Philippines joins this global movement on TFA elimination with the publication of DOH AO number 2021-0039, which is the first in the country that calls for direct action on TFA. As the DOH-AO builds momentum on trans fat elimination, the Trans Fat Free Philippines bills currently pending with the Congress must be passed urgently to cover all food, and ensure that Filipinos are fully protected from the harmful health effects of TFA. Equally important is public awareness and education. We must simultaneously continue our efforts on nutrition promotion, ensuring that the Filipino people have the health information they need to make sound decisions on their food purchases and their diets. We call on our experts, partners in civil society, media, and other national government agencies to join the DOH in communicating and promoting the elimination of TFA in the Filipino diet. At the same time, we enjoin the private sector partners, particularly from the food and beverage industries, to help us realize a trans-fat-free Philippines through deliberate elimination of TFA in food manufacturing and production. Together, let's all work towards a healthy Pilipinas.
Thank you very much for that message, Dr. Ho. I think we have just one there. We have a question here, one last pahabol from our audience. Seasonings like magic sarap, nor cubes, toyo, suka patis, may mga TSA po ba siya? Well, I'll address this question to Sir Rodley of the Department of Health. Would you like to answer this quick question?
Hi, Maan. We'll check lang the ingredients of, I haven't checked the ingredients of Nor Cube, so I will get back to Ma'am Caroline between na lang on this. But for the other ingredients such as toyo, suka, patis, I think walang masyadong oil content to, if meron man. But again, I'll have to check for the specific food items that Ma'am Caroline placed here. Thank you.
Thank you. Thank you very much for that, Roddy. And yes, just to echo that, Ms. Caroline, really, ang tip namin sa ganyan, i-check ang nutrition label, tingnan ang ingredients list. Usually kapag may partially hydrogenated oil, shortening, yan ang mga indicators natin ng trans fat. So yun lang po. Again, maraming salamat sa lahat ng nanood sa amin at sa lahat ng nag-participate ngayong hapon. We are very, very thankful that you took interest in joining the webinar this afternoon. So we hope that we can continue the conversation, and we hope that we can continue to work together towards a healthier Philippines, a healthier Filipinas, and a trans-fat-free Philippines by 2023. See you all again, and good afternoon.